cord should not According to the Unang program, the cord should not be clamped until pulsations have stopped. That's about 1 to 3 minutes. Before performing a Leopold maneuver, the nurse should ask the patient to empty her bladder. Pelvic tilt exercises can help to prevent or relieve backache during pregnancy. Erythromycin is given at birth to prevent ophthalmia neonatorum. The nurse must place identification bands on both the mother and the neonate before they leave the delivery room. Subinvolution may occur if the bladder is distended after delivery. For an extramural delivery, one that takes place outside of a normal delivery center, the priorities for care of the neonate include maintaining a patent airway, supporting efforts to breathe, monitoring vital signs, and maintaining adequate body temperature. The administration of oxytocin/pitocin is stopped if the contractions are 90 seconds or longer. If a pregnant patient's rubella titer is less than 1.8, she should be immunized after delivery. Breastfeeding of a premature neonate born at 32 weeks gestation can be accomplished if the mother expresses milk and feeds the neonate by gavage. Dinoprostone cervidil is used to ripen the cervix. A mother who has a positive human immunodeficiency virus test result shouldn't breastfeed her infant. The fundus of a postpartum patient is massaged to stimulate contraction of the uterus and prevent hemorrhage. Hot compresses can help to relieve breast tenderness after breastfeeding. Laceration of the vagina, cervix, or perineum produces bright red bleeding that often comes in spurts. The bleeding is continuous, even when the fundus is firm. A patient who has postpartum hemorrhage caused by uterine atony should be given oxytocin as prescribed. To avoid puncturing the placenta, a vaginal examination shouldn't be performed on a pregnant patient who is bleeding. Because women with diabetes have a higher incidence of birth anomalies than women without diabetes, an alpha-fetoprotein level may be ordered at 15 to 17 weeks gestation. During the transition phase of labor, the woman usually is irritable and restless. Painless vaginal bleeding during the last trimester of pregnancy may indicate placenta previa.